Je, mvulana au msichana, wajua kwamba Mwenyezi Mungu anaendelea kuita watu wake hadi wa leo ili waweze kumtumikia? Je, unajua kwamba unaweza kuwa mmoja? Jo katika shirika letu
Kenya, offering competitive training in nursing education, innovation, research and professionalism.
We are a nursing school that was started way back in 1972, chartered as a midwifery school. The school is run by a highly qualified faculty. All the departments, for example, you look at midwifery, it's headed by someone with a PhD in midwifery. Critical care is headed by a highly specialized person with a master's in critical care. Nephrology, the same. Our clinical instructors for these programs are also specialized in their various fields.
The school is licensed and accredited by the Nursing Council of Kenya to offer holistic training in various nursing programs.
We have general nursing, that is the Kenya registered nurse. We have higher diplomas in Kenya registered midwifery, Kenya registered critical care nurses, Kenya registered nephrology nurse, and also we have theater nursing, which is called Kenya registered perioperative nursing. We do admit our students from all over the country, especially for the basic diploma, that is the Kenya registered nurse program. And for higher diplomas, we admit, again, we have a Pan-African presence. We have students from Congo, from Rwanda, from Uganda, and from other countries. But basically, most of our students are Kenyan, those ones who have graduated from our Kenyan institutions.
Enjoy your learning in a friendly environment with adequate training facilities, including a fully fledged skills laboratory, library, lecture halls, and accommodation amenities.
We have good facilities for our training. We have a very well equipped skills laboratory. This is for all the programs, both the basic diploma, the Kenya registered nursing, the midwifery, the critical care.
Nursing is a noble profession because we work with our clients at different stages of their lives, right from birth up to end of life. When a baby is born, a nurse is present. When a baby is brought to receive vaccines, a nurse is present. When you fall ill, the nurse is by your side. And even at the end of life, a nurse is present. So we are there to give our services throughout each stages of human life.
For more information, call us on 0732 163 164 or 0719 073 164 or visit our website at www.matakenya.com. A very warm good morning. You indeed deserve it, and you are right on time for the Friday Health Discourse brought to you by Capuchin TV in partnership with Mater Misericordiae Hospital. Now, just a sneak peek of what we are set to discuss today. Remember, we bring you this discourse just to enlighten you more about different medical conditions, how they are diagnosed, the different risk factors, just to make sure that you stay healthy and seek medical attention as soon as possible. So right now we are set to discuss peptic ulcer disease. Others know it as stomach ulcers, and it also people call it hyperacidity, but you're just going to hear from the experts how different is hyperacidity from peptic ulcers, and of course among different aspects and issues or details about this medical condition. With me in studio is none other than Dr. Okullo Isaac. Good morning.
Morning, how are you?
I'm fine, thank you.
Yes,
How
okay.
has your week been?
That's been great.
Thank you for creating time for this discussion.
You're welcome.
What do you do at Mater Hospital?
I work as a medical officer at Mater Hospital. Yes,
Which unit specifically?
Work in emergency department and outpatient.
Are you based at the main hospital or one of the satellite
No,
clinics?
mostly in the main hospital, but once in a while, you can still find me at the satellites.
You do rotate?
Yes.
Okay.
Yes, okay.
Welcome. So Dr. Okullo has been here. He's not a new face, and he's going to take us through this. Just feel free to weigh in on the discussion through sending, you can send questions, you can contribute towards this discourse by dropping your feedback on our social media platforms or our number 0717-424-866. The hashtag to use as usual is hashtag health discourse, or rather Friday health discourse, hashtag Sasha Elizabeth. So welcome. Let's walk this talk. Welcome again, Dr. Okullo.
Thank you.
Let's start by understanding the term peptic ulcer disease. What is it and how different is it from hyperacidity?
Thank you so much for this opportunity. Just to be, as I said before, the topic that we are discussing today is something that is known to so many people. But we just want to create more awareness and make people know exactly what to do when you start feeling symptoms and signs that point towards this disease. Peptic ulcer disease is a simple way of saying you having too much acid in the stomach. Okay, the word peptic will come from the stomach wall, which has some glands that secretes more acid content. Okay. Also, this acid can be secreted from the pancreas, which is also an organ that is very important in facilitating digestion. So when all this acid content comes within the stomach, it comes and help to facilitate the digestion, and also help to neutralize maybe the bad content that has come with food or whatever you have taken. And therefore, these things are acidic in nature. So what they do, the idea for it is to make sure the environment is safe. Whatever you have taken inside should be safe. And then after you have eaten your food, it's none of you don't think about it, but the food may not be very sterile, as we always know. And then the system or the stomach itself is designed to start protecting yourself. Okay. Now, as they try to break down or to kill this bacteria or this pathogen that has come with food or the drink, they can also end up corroding the walls of the stomach. Okay, and as they try to corrode and if they're trying to do that, they can attack the wall of the stomach, and therefore, when it attacks the wall of the stomach, it can lead to pain, or it can lead to the wound. And when it causes the wound, now you start having symptoms that presents with pain, okay, in the stomach. Maybe when you're hungry or when you have eaten, after sometimes you feel the pain. So this now describe what we are calling the peptic ulcer disease. Now,
how different is it now from hyperacidity?
Now when we talk of hyperacidity would be a simple or a layman term or a normal terminology. We're calling it from acid level. The acid level, which is higher than the normal, the body can contain, because the stomach wall is designed to contain particular amount of acid in the stomach. But if the secretions of the acid is too high, okay, or for whatever reason, in the wall of the stomach there is a alteration or there is changes in the balancing of the acid level in the stomach, it makes the amount of acid becomes high, and therefore too much acid will also attack the wall of stomach, and then it will cause the pain. Now when you attack the wall and the acid alone, it causes corrosions. So when the acid causes corrosion on the wall of the stomach, you start feeling pain because there's already a wound in the stomach. And now that wound is what we're calling it ulcers. Okay, so hyperacidity will also bring the symptom, the same like the way peptic ulcers will also come. So when you look at hyperacidity, it's like a layman term of talking of peptic ulcer. Okay, so the wound happening in the wall of the stomach because of too much acid, that is what we call hyperacidity or peptic ulcer disease.
Okay.
Yes.
Thank you very much for that in-depth explanation on the similarity and differences between peptic ulcer and hyperacidity. So now, what is the prevalence rate of this medical condition? Is there a specific group or gender that is more at risk of contracting peptic ulcer disease?
Peptic ulcer disease, the prevalence, I can say it's generally high in the general population, and it is mostly related with occupation sometimes, the work you do, and also your lifestyle also. For instance, people who work and they tend to work extra hours and they do not get time sometimes to take their normal food at the right time. They tend to have a high level of acidity because the time they are supposed to eat food, they are not able to eat, and therefore it's like they are starving. And in that case, they tend to develop at a higher risk of developing this disease. It is rarely seen in children, though some few percentage of children also have this condition. Okay, they also tend to have high level of acidity, and that they get treated and normally they get better. But sometimes it takes time for parents to notice that the children are having hyperacidity because they do not think it also occurs in children. But the majority normally in elderly people also is very common. Almost all elderly people tend to have acidity. Even the young generation, we still also have the acidity level. So the prevalence is quite high, also in the rural setting and even in the urban setting because of the nature of the job people are doing. And in the rural setting, it's more common because sometimes people eat 1 meal a day or 2 meals a day, and because of maybe they go to the garden, they spend a lot of time, but when they come back, they eat in the evening, so they also tend to develop a lot of acidity. And in the urban area still, the populations at large are actually the working people because sometimes they really get engaged and they don't get time to eat. And I think if you do a study in the health sector where we have the health professional, I think most of them, or most of us, we tend to have peptic ulcer disease. Reason being, we tend really we get too committed, and sometimes maybe the place is too busy, and you really don't want to go have lunch because you have emergencies always, and when people come, they are really sickly, and sometimes you don't feel hungry because you really want to see someone better. At the end of the day, by the time you now start thinking that you're hungry, at around 4 there, you're really having some burning pain in your stomach. But you did not plan for it. It's just the nature of the job and the calling of the environment and the nature of that day that tend to predispose most people to this. When we discuss more about the causes and how to avoid it, we'll tend to understand why I'm saying some population are at risk of getting this.
Yes, I think that should be our next questions. What are these causes of hyperacidity or peptic ulcer disease, or the most common risk factors that someone might be really at risk of having this condition?
This disease is it's normally not caused by one single agent. As I said, we can look at the lifestyle and the diet, okay, as one of the major causes of this. But also we have some genetical predisposing factors that tend to expose some people to develop this condition. When I talk of diet, we're going to look at whatever we eat. Most of the food that we eat sometimes can make us develop this condition. For instance, if you take a lot of acidic food that contains a lot of acid, people who take alcohol, they tend to have this kind of disease. And also, as we said before, some nature of job that do not expose some people to eat is like the eating habit now. The time you're supposed to eat, as you're drinking, all these can predispose you to develop the condition. And then when I talk about the genetic or inherited, that's what is called the Zollinger Elution syndrome. This is like the people who normally have too much acid production in their body. There are hormones. Yes, there are hormones that regulate production of acid in the stomach, and therefore there are people who get high stimulations or high production of that hormone level. So this hormone level make them to produce a lot of acid in the stomach, above the normal range of the acid level that one should have inside the stomach. So that alone can make them develop this kind of disease. Okay. Then there are other conditions that we'll discuss later that present and mimic, like you having peptic ulcer disease, and yet it is not the peptic ulcer disease. Okay, when we reach a point when we'll be talking about what are these other conditions that look like peptic ulcer disease, and yet they are not the one. And I think that's why this discussion is very important for us to be able to think beyond peptic ulcer disease. Another thing I was about to forget is the infection. We call it H. pylori. It's one of the major bacteria that stays within the wall of the stomach, and it has the capability to withstand the acidic content of the stomach, and it is never destroyed by the too much acid in the stomach. And because of that, it is also a major cause of someone developing the peptic ulcer disease. Yes,
now, we are living in a world with a lot of pressure and stresses. Is stress part of the causes of ulcers?
Yes. Researchers have shown that when you stress, you release what is called the stress hormones, and these stress hormones also, it has direct link to the hormones that make you produce a lot of acid. Okay. Now, if you are stressed, sometimes you realize your eating habit tends to go down. There are people when they're stressed or they're having depression, they do not eat. They go into depression and they feel like they're full. Every time you present food to them, they don't want to eat. And what's happening? The stomach wall, it is preparing itself to receive food, and you are not giving in food, and therefore there's too much acid is being produced there, and your psychology is telling you you're full, but there are a lot of activities happening in your stomach, and therefore at the end of the day, too much acid will cause the corrosions, and it will cause the wound, and then you'll develop the disease. Yes, so there's direct link.
Okay, thank you for that. Now, what signs and symptoms are associated with hyperacidity or peptic ulcer disease, briefly?
Peptic ulcer disease, most people really have the presentation, but we can categorize it in the uncomplicated and in a complicated one. So the uncomplicated peptic ulcer disease, or this hyperacidity, normally it's like burning pain, burning sensation in the stomach, and it's normally the upper part of the stomach. Okay, then you will have sometimes you have bloating, or your stomach swells after eating something small. You feel a lot of gas in the stomach. These are the two most common symptoms or signs and the presentation. Then sometimes you feel like vomiting, or even sometimes patients do vomit. You vomit after eating something, you feel too much pain, and then you vomit. Then now when you go to a complicated one that brings a lot of worry is sometimes you vomit blood, okay, or sometimes when you will have other uncomplicated presentation, and also at the same time you will be having this complicated presentation. Like you're not only vomiting, but you're vomiting blood, And then also sometimes the change of color of your stool, because if you are bleeding now, because in a complicated case, sometimes you're bleeding, okay, and in this case, your stool color will also change, and it will be like dark in color. So when you start noticing such things, change of the stool color, vomiting blood, severe pain in the upper part of the stomach, and then swelling, and when you even touch the stomach, you feel someone is in severe pain. Eh? So all those will give us the clear sign of peptic ulcers disease. Yes.
Okay, now at what point does the bleeding occur?
Okay. Bleeding generally occurs in the wall of the stomach where there is corrosion. Okay, you are aware that the wall of the stomach is lined by layers. The first layers are the layers that protect acid from attacking the normal wall of the stomach. Okay, now this layer is covered by what we call the base. Now when you have the acid, you're going to have the base, and then you're going to have the salt. When you combine acid and the base, you get the salt. This is like chemistry now. Acid and base, you get salt. Okay, but acid is being produced, and then in the wall of the stomach wall, we have the base. Now when acid comes, it mixes with the base, and then it forms the salt, which is harmless in the stomach wall. Okay, now when there's too much acid, the balance is overpowered. When you overpower the balance, that means the surplus is going to be acid. Okay, now the acid will get time to penetrate in the wall of the stomach, and acid is going to burn. It's like fire. It's going to burn the wall of the stomach, corrodes the wall of the stomach. Acid corrodes, it creates the wound, it creates the hole. Now these corrosions is not going to be specific which part of the wall should be corroded, because in the wall of the stomach we are having lining of the blood vessels. The blood that is bringing good thing or substance to the wall of the stomach and removing them, we have the blood vessels there. Now the corrosion will attack the blood vessels. So when attack, the blood vessel will open, and therefore you start bleeding now in the wall of the
Thank
stomach.
you very much, Dr. Okullo. My
Welcome.
director says it is time to take a break. But keep it, Capuchin TV will be right back with more information, especially on how an ulcer attack happens, how is it curable, what are some of the preventive measures, and of course dietary recommendations to prevent or to just mitigate or manage this condition. Stay tuned.
TV, your Catholic broadcasting ministry. Welcome to Misericordiae Hospital, Nairobi CBD Medical Center.
Development House Medical Center was opened about slightly above 10 years ago, and since then we've been providing ambulatory care to clients who come to us. The clinic is located between Tomboya Street and Moi Avenue, right opposite the Pioneer Building.
We guarantee our patients quality standards and variety of medical services.
At Development House Town Clinic, we have the following services. We offer doctor's consultation. We also offer physician services on Mondays and Fridays, obstetric and gynecology services on Wednesdays and Saturdays, nutritional services on Fridays. We also have a well-equipped pharmacy, a well-equipped laboratory. We have physiotherapists, and we also have just begun our wellness services as a way of encouraging preventive medicine.
We provide specialized services, that is gynecology and antenatal clinics. We provide services to the diabetics and the hypertensive patients. We give nursing services. We will do your dressing, we give you injections, we also provide some counseling services. We have specialized counselors that would give you natural family planning counseling and guidance. and you'd also get the general counseling. We also provide adult immunization, and basically for adults who want to travel, we are able to give you the vaccines that you need.
We uphold the dignity and privacy of our patients as we strive to meet your healthcare needs holistically and in a more compassionate way.
The service that you'd receive at our medical center is a value with a touch of Christ. We do not just want you to be taken care of physically, but you also think about your spiritual care and spiritual growth.
Visit us every Monday to Friday from 8 a.m. to 6:30 p.m. and every Saturday from 9 a.m. to 3:30 p.m. and get value for your money.
We ensure that you're seen within the shortest time possible, however, providing quality care.
I welcome you all to Mater Hospital CBD. We assure you of timely, efficient, and satisfactory services.
Capuchin TV, your Catholic identity.
Welcome back. This is Friday Health Discourse with me, Sasha Elizabeth, and in studio I am with Dr. Isaac Okullo from Mater Misericordiae Hospital. We are discussing demystifying peptic ulcer disease, and as you had in our first discussion, it is a common condition, especially the older you grow, the more you are at risk of developing this condition. So welcome back, and keep your questions, keep your comments coming on our social media platforms. Emoit, thank you very much. He is one of our fan. All right, so welcome back, and let's continue with the discussion. There are some questions that are popping up, Doctor.
Yes, ma'am.
Someone is asking, how little can stomach ulcer get?
That's a very good question. Mm-hmm. When we talk of complicated peptic ulcer disease, where there is involvement of bleeding mm-hmm. and vomiting of blood, now that becomes an emergency. Okay, mm-hmm. We categorize it under medical emergency, mm-hmm. Whereby if not handled properly, you can lose someone within a very short period of time. Because if the wall of the stomach has been corroded and you attack the major blood vessels in the wall of the stomach and someone starts bleeding actively, that means the immediate thing you need to do is to do urgent resuscitation and the urgent correction or arresting the bleeder or in the wall of the stomach on this particular patient. Mm-hmm. So it can be extremely lethal. That's what I can tell our viewer.
Okay.
Yes.
Thank you for that. Now, what is the most common complication of peptic ulcers?
The most common is bleeding. Mm-hmm. Okay. And once someone is bleeding, it's like you've been involved in a road traffic accident. Mm-hmm. When someone gets in road traffic accident, get a cut, then you start seeing blood gassing out. Mm-hmm. That's the same thing that also happened in the wall of the stomach. Mm-hmm. The acid becomes too much and it corrodes the wall of the stomach and gets the major blood vessels in the wall of the stomach, mm-hmm. and then you start gassing blood also in the wall of the stomach. Internally. Mm-hmm. And since it is internally, it's more dangerous than what you're seeing outside. Mm-hmm. So this one of the worst complication, and it is one of the advanced training that we normally have in the hospital settings to handle what is called the upper GIT bleeding. It can be caused by so many things, but peptic ulcers is also one of them that causes upper GIT bleeding. Okay.
Right, thank you for that. Now, how do ulcer attacks happen?
Oh, the ulcer attack is what I tried to explain about. We can just say about the that's in the medical term is pathophysiology. Okay, in the wall of the stomach, we are having secretion of acid. Okay, then from the pancreas, we are also having the secretion of what is called pepsinogen. The pepsinogen is an enzyme. It comes when it's in form of like inactivated form, and these enzymes need to be activated so that it can become active. Okay. Now, if you do not have the wall, the barrier of the wall of the stomach well, remember this enzyme is coming, and its major goal is to digest the protein. Okay. The wall of the stomach is also made up of protein. Getting this, the wall of the stomach made up of protein, and you are having enzymes which is coming to digest the protein, the food you have eaten. Now, this food has to be broken down by these enzymes. But remember, this enzyme is breaking down protein, and the wall of the stomach is also made up of protein. Now, if the barrier has been overcome, okay, that means even these enzymes that is supposed to break the protein, which is food, it will also end up trying to break down the wall of the stomach, which is also protein. Now, in that process, it's going to cause a wound, okay, in the wall of the stomach. So this combination of two, having these enzymes that breaks the wall of the stomach, ideally you're supposed to work on the food. They're also having this acid that is supposed to help in decontaminating or killing the bacteria in the wall of the stomach. Since the barrier has been overcome, it's also going to corrode the wall of the stomach. Now, as they do this, they cause the wound. And when they cause wound can go and also attack. It can extend and get into the wall of the stomach. That can cause bleeding. And the second major complication can cause what is called perforation. Perforation is now creating that wall until it comes out of the wall of the stomach. So you get a hole now in the wall of the stomach. That means you're having direct communication with the external environment within the stomach, and then they're having direct communication with the interior wall of the stomach.
All right. So now for a layman who does not understand the processes that are going on within the digestive system, how can they tell externally that this is a peptic ulcer attack?
To them, they always come with what we normally ask them, okay? We ask questions, which we are calling it history taking, and the way you talk to us, it guides us so that we can come with a preliminary diagnosis that you should be having peptic ulcers. But everybody there, when you start feeling stomach pain, okay, you're feeling stomach pain, you're feeling like you want to vomit, you're feeling after eating something too much pain, or after eating something you stay for long and then you get a little bit of pain that comes in, or after eating you feel like the stomach is, you're having too much gas in the stomach. This should be a very good suspicion that you should be having peptic ulcer disease that is happening, and you need to seek for medical assistance so that the expert can be able to tell whether it is peptic ulcers or something else related. Okay.
So would you advise a self-diagnosis, or the condition requires medical diagnosis at a medical facility?
I think that is where our discussion has come in, because we tend to be knowing it a lot, and therefore we manage a wrong thing. Okay. As we shall move on with our discussion, you will know that not every pain in the stomach is ulcers or is peptic ulcers. Okay. So my advice is, the moment you feel some stomach pain that is not the normal stomach that you used to have, don't do self-diagnosis. Walk to the hospital, see the expert, let them listen to you, let them examine you, let them investigate you, because we need to arrive at a diagnosis. Okay?
We are at an age in time that we really trust Dr. Google and OTCs, the over-the-counter prescriptions. But doctor says it's not advisable to do that. So on that note, could you tell us what are these medical conditions that could mimic stomach ulcers?
Oh, there are quite a lot of them, and this is where we need to be really very careful. That's why I always advise my patients that in case you don't feel anything good with your stomach, kindly walk to the hospital and get assisted. And if you walk to the hospital and you get treated and it doesn't work the way you want, keep moving forward, because there are also a level of management in the hospital. It varies, it keeps increasing depending on your presentation. Okay, so if you look at the stomach pain, can be caused by so many things, especially we are concentrating on the upper one. One, peptic ulcers is one of them, okay? Another thing that can cause this, we have seen with the high level of technology and the advancement in the medical field, when you have stomach pain, the upper part, you can be having what is called acute coronary syndrome. Acute coronary syndrome is heart attack, okay? There are people who are getting blockage in the heart, and the heart is not functioning well. But what do? They keep getting medication for peptic ulcer disease. They go over the counter, they pick the medication, they take, the pain goes down a little bit, and they feel like they're okay. And yet someone is having heart attack that if it had picked before, you cannot go into complications to the extent of losing your life. Another thing, you can have a gallstone in the gallbladder. We know very well the gallbladder is next to the liver, but the gallbladder stores the bile duct. Okay. Now this bile duct, if you have stone in the gallbladder, it presents like you're having ulcers or hyperacidity, and you can be refilling medication, and yet the problem is not ulcers, but the problem within the gallbladder. Another similar presentation that people normally confuse is that some people who have stomach cancer of the stomach. Okay, you're losing weight, sometimes you get full so fast, and you're having a stomach pain. On thorough examination and checkup, you find someone is having cancer of the stomach. There are some people who have very rare condition. They could be having also the cancer of the pancreas and present almost the same thing. So when you keep refilling medication, some of these things can be missed out. Another common thing is people who take a lot of alcohol, you develop what is called, you can have chronic pancreatitis or acute on chronic pancreatitis. So you get injury that has occurred already in the pancreas, and then you keep taking medication for acidity, and yet the problem is within the pancreas. Okay.
All right.
Okay, yeah.
Okay, thank you, Dr. Okullo. Now, first, let's go to the most asked question.
Yes,
is stomach ulcer treatable or curable?
Stomach ulcers is treatable, okay, and is curable.
All right, so now share with us, what are these treatment options and prevention options available for peptic ulcer disease and hyperacidity?
Okay, if we start with the prevention methods, we're going to emphasize more on the diet, okay, and the lifestyle. People who drink, basically, in the long run, they tend to have acidity. Not almost everyone, but most people tend to do that. So if you really have the sign and symptoms of peptic ulcers or hyperacidity, then you should minimize alcohol intake. If you really have it, you should look at the food you're eating. You avoid food that contains a high level of acid. That will help you in the prevention. You need to look at your eating timetable. You need to follow it well. It will also help you in the prevention of developing this or worsening the symptoms. Okay, and when it comes to treatment,
Before we get to treatment, what is the recommended eating interval?
The recommended eating interval sometimes does what's called conditional learning. The body learns how it operates. Okay, if for instance you take tea every 10 a.m., try one day skip that tea and take it at 11 a.m. Before you reach 11 a.m., you either will be extremely hungry, okay, or you will have pain in the stomach. Why? The body has learned that at 10 a.m. we normally receive food. So at 10 a.m. when the tea is coming, I should have acid ready in the wall of the stomach. I should have the enzymes ready in the stomach to receive the food. But then when they come and the visitors do not come, they get disappointed. Okay.
All right. So it's all about personal choice and planning to condition your body. All right. So to the treatment, what modalities are available for this condition?
The modalities is you identify the cause. What's the major cause of this? Then you tackle it according to the cause. If it is alcohol, reduce it or stop it. If it is your eating habit, try to make it regular and follow it and stick to it. If you enjoy a lot of acidic food, a lot of spicy food, try to reduce on them. This will also help in management of this. Now, if the cause are like too much secretion of the acid in the wall of the stomach, the medication that are given, we call them PPIs, or omeprazole is the most common one that everyone will want to go and pick it, but we call them PPIs. So this try to suppress the too much secretion of the acid in the wall of the stomach. So we can give you that medication to try to suppress it down. And then if the cause is what we call H. pylori, which is sometimes also contribute to acidity, we treat that bacteria, we treat that infection, and then we have the kit-specific medication for that the doctors or the medics will give you, and then they'll eradicate the H. pylori, and definitely will come back to normal. But then there's another one that I've not talked about, okay, that we have the junction between the esophagus and the stomach. We call it the cardiac sphincter, okay. This junction is supposed to be tight after food or liquid has entered in the stomach. But in some people, it doesn't close tightly, okay? It leaves a gap in that you get a backflow. So you get a heartburn that comes on the chest, okay? Now, in this case, it is more of a mechanical problem, or sometimes we can, if I say mechanical, it will be so, it's not be a good terminology, but then I can say it is something that is structural in the body. There's a gap already. And this structural gap cannot be corrected by medication or by any modification. You can do other modification, but the symptoms will always persist. So in this case, these people, we do surgery for them. They try to tighten that gap, so that every time you eat your food, it should open and close tightly, and therefore there will be no backflow of the content of the stomach wall. And these people, after the surgery, they really do very well, and they get out of medication. Okay.
So that could cause stomach acid.
That could cause the stomach acid.
Okay. Now, some medical researchers have revealed that lemon could be used in treating or curing peptic ulcer disease. How true is this?
Lemon juice. Lemon juice would be worsening the situation. Okay. There's some food that it is good because they form like a complex in the wall of the stomach. For instance, like maybe yogurt and milk and water and all those things. But then when we talk of lemon juice first of all contains a lot of acid. Okay. Now when you take the lemon juice, you tend to make the level of acid in the stomach wall goes up. And now when it goes up, it will actually worsen more and cause more pain than trying to cure it. Okay.
There has been really, this is something that has really sparked debates, especially among the medical cycles, with some saying that lemon could be used, some little bit of it squeezing on your meal could help heal the sores in the stomach, but others are of the contrary idea. But our time is up, and as it is a tradition, before I close, just a few seconds to our guests to give us his parting shot.
Okay, thank you so much. I think to wind up everything, I just want to be more specific on the differential diagnosis or the possible cause of the stomach pain. That we shouldn't think that every stomach pain that we get, it is peptic ulcers or it is hyperacidity. We need to think beyond hyperacidity, and because of this, we need to seek the expert's opinion. You need to see the medical personnel. You need to be advised accordingly. You need to be examined, and you need to be checked. Otherwise, it will be too late for you when you're just thinking it's acidity, and yet it is cancer, and yet it is something else, and that will be very bad for you, because it will be picked at a later age, and yet you have been thinking you do not have other conditions, you have only acidity. So let's seek the right place, let's go to the right places, and let's modify our lifestyle, and let's live a healthy life. Thank you so much.
Thanks to Dr. Okullo for this informative session. Best in your work there at Mater Hospital. Our regards to everyone, especially Dr. Maria, Dr. Sister Maria, and Sister Mweni Benedict. All right, dear viewer, it's time to wrap up this discussion. As usual, we do our part and leave the rest to you to make the right decisions and choices in as far as your health and lifestyle is concerned. This has been Friday Health Discourse with me, Sasha Elizabeth. I've been working with the team behind the scenes with my camera person right here with me, Felix Juma. Thank you very much. And our sound operator has been Eric Otieno. Thank you, Eric, and thank you, Michael Ndegwa. He has been working on the visual mixing part of this live transmission. And on the transmission desk, we had Michael Kibandi. So we appreciate you all for your concerted efforts. Thank you very much, and I wish you a great weekend. My name is Sasha Elizabeth. Goodbye.
Capuchin TV, your Catholic identity.
Welcome to Mater Misericordiae Hospital, Buru Buru Clinic for holistic medical services.
This is Buru Buru Medical Center, which is part of Mater Hospital. And at Buru Buru, we essentially offer services offered in Mater Hospital.
We are located in the first floor failing building above Quickmart. In Buru Buru, we have general consultation Monday to Friday. Saturday and Sunday, they are still available. We still have specialists. On Tuesday and Thursday, we have gynecology clinics running from 8 a.m. to 2 p.m. We have a pediatrician clinic running on Wednesday at 8 a.m. to 2 p.m. We normally have a wellness, which we normally do from Monday to Sunday. Every day, feel welcome, you can come.
Experience the difference in our wide range of quality, responsive and compassionate healthcare services.
We have very highly skilled and qualified staff running the units. We offer services including doctor's consultation services, which is the general doctor in the outpatient unit. We also have laboratory services and pharmacy services. On particular days of the week, we have specialized clinics, which include the physician clinic, where we have our hypertension and diabetes patients followed up. And then we also have the obstetric gynecology clinic, which is run on Tuesdays and on Thursdays. We have the pediatric clinic, which is run on Wednesdays. And then we also have the ENT clinic, where we have the ENT doctor coming in, and that is run on Fridays in the morning. There is also a pediatric surgery clinic, which is also on Fridays.
Our child welfare, we normally do them on Wednesday, Friday, and Saturday from 8 a.m. to 2 p.m. We have our ENT clinic Friday, 8 a.m. to 10 a.m. We normally have nutrition services on Tuesday to Thursday, and we have extended our radiology services from Monday to Friday to Saturday nowadays. Initially we were running up to Friday, but currently going up to Saturday.
We deliver all our services with utmost diligence, integrity and equality.
We see everyone at the Buruburu branch. We do not discriminate against anyone, either on race, on religious grounds, or disabled people. You are all welcome to receive services at our branch.
Be assured of privacy. We normally keep to our ethics. We are so compassionate to our clients. Integrity is all over. So when you come, we feel you, and that is why you can see nowadays we are running, like every Friday we are having a special clinic. Currently we are running the breast clinic. Next month we are coming up with clear colon screening. So don't forget we are Christ-centered. When you come, and we don't segregate because you are a Christian or a Muslim or Hindu. We treat every client as equal as any other.